As 2023 comes to a close, so does Dr. Erik Martin's 2-year term as president of the American Organization for Nursing Leadership, or AONL. Erik rejoins our podcast series for his thoughts as his 10-year service on the board comes to a close. Erik is a DMP prepared nurse and vice president of patient care services and chief nursing officer at Norton Children's Hospital. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Welcome back, Erik.
Thank you. Thanks for having me back, Nick.
Now, you were a guest last year in Season 1, Episode 7, when we talked about the current workforce challenges in nursing practice. As you are coming to a close on your 10 years on AONL's board, including serving the last 2 years as president, let's actually start with the same two questions as in that episode. What's keeping you up at night right now as a CNO?
So much has changed in the world of nursing, and yet nothing has changed in the world of nursing, right? I think a lot of the same workforce issues that we were faced with this time last year, we've made significant progress on. And I can feel the conversations shifting from problem-based to solution-based, but this is going to be quite the journey for us. It's going to take years for us to work towards solution. In terms of what keeps me up at night as a CNO, I think just living in the post-pandemic or the post-COVID world that we have there's some realities to that. We were dealing with a pretty young, inexperienced workforce, and most of the individuals that have entered our profession in the last couple of years have had some sort of altered clinical experience within their education. And so that may have looked like less clinical hours, more simulation, more computer-based education, but certainly less hands-on in-person interactions with individuals. And as that has played out, not just in my own organization, but in organizations across the nation, challenges with preserving high-quality care, a safe environment, great, patient experience. And those are some of the things that we try to make sure that we're supporting our team and our frontline leaders to make sure that we preserve that.
Any key pearls of wisdom that you've glimmered from within your own organization as you try to solve this new paradigm?
For us, it's been a lot of leaning in and making sure that we focus back on the basics. The simple things that I think a lot of us took for granted that we got in nursing school, like donning PPE and the 5 moments of hand hygiene and the safe medication delivery. Those are things that these individuals have a lot less experience or interactions in doing. And so a lot of our focus has been on making sure that our onboarding practice is thorough, that they are not just getting acclimated to our culture, but that they are also getting some of the basic things that we probably took for granted for many years as just being a part of their practicum or clinical experience and that they got in nursing school.
And so if that's what's keeping you up at night right now as CNO, although when this episode airs, it'll be about 2 weeks left in your term as president. Anything keeping you up right now in your role as president or a board member of AONL?
A lot of it is interrelated. I think my perspective or the lens that I wear as a CNO really, or if the practical reality that, many of the nurse leaders across the nation are living with on a daily basis. The lens that I wear as president, I think I just see that magnified. And in some ways, it reinforces that none of us are alone. We all have the same common challenges. And in other ways, it feels overwhelming that we've got such obstacles ahead of us. But ultimately, I'm inspired by the conversations that we're having to identify solutions that are beneficial to nurse leaders across the nation. So what keeps you up at night as president is still workforce issues. That's not changed. And I think when we talked last year, if I recall correctly, I said workforce is a pretty generic term that under that umbrella falls a lot of things. You're talking about not just staffing, but also nurse well-being and workplace violence and all of the things that go along with those main components that fall into the workforce. I see those issues more globally as president, and I can connect the dots on how challenges that we have in academia with securing good clinical instructors and professors impact the care that we can deliver in the hospital setting. And then how the care that we provide in the hospital setting and trying to get patients out to whether it's skilled nursing facilities or rehab or home with some home care. If we're not staffing those environments, then we're at a gridlock or a bottleneck and don't have a place to send these patients as we're trying to move them across the continuum of care. So everything, it's a domino effect and everything plays off one another. And I think that's been one of the biggest benefits of me serving in this role is that I don't just have a perspective from an acute care organization. I've been given the opportunity to see things across the spectrum.
Yeah, what you're talking about really makes me think of, I think it was Dr. Jerry Mansfield, who's a mentor of mine when I was working on my master's degree, talked about at the time he was going through the Robert Wood Johnson Executive Nurse Fellowship Program. And I know that there's been transitions and changes in that program, but he talked about the intersection of policy and practice and academics and how we've got to get the leaders in those three domains together to better advance healthcare for all and nursing practice and patient outcomes for all. Would you say that workforce challenges right now is the greatest challenge facing nursing leadership?
I would. And if I can comment on your recollection of what Jerry had his perspective with you, one of the things that I do as president for AONL is sit as a member of Tri-Council.
Yeah.
Tri-Council, for the listeners that aren't familiar with it, you hear the term tri and you think there's three professional associations that come together. It's in fact 5 professional associations that focus on 3 things. So we have AONL, ANA, the American Association for Colleges of Nursing, so AACN, the National League for Nursing, NLN, and the National Council for State Boards of Nursing come together are the 5 associations. We tried to find some things that we can align our voice on. And when we are up on Capitol Hill advocating for things that are important to our profession, we try to speak in one voice. And Jerry's insight that you share with us is spot on and really some of the bigger, more global work that we're trying to do to support nurses across the nation.
So as we talk about workforce then, and I guess maybe answer this both ways, what is both AONL and then also what is Tri-Council doing to position itself to support this challenge?
So I think I probably shared a little bit of this with you last year when we met. One of the first things I did as president was start a workforce committee for AONL. Not to be too long-winded, but I've had the benefit of serving on AONL's workforce committee and the American Hospital Association's workforce committee and the Kentucky Hospital Association's workforce committee, representing nursing leadership in all 3 of those committees, and all of them through a little different perspective. AONL has been very focused on how we can support nursing leadership through the workforce challenges. The American Hospital Association has been very focused on how we can support all healthcare professionals in addressing some of the workforce challenges. And then the Kentucky Hospital Association obviously has been more focused on our state and the challenges that our state faces that are unique to us. To further elaborate a little bit on what AONL has done, last year, the workforce committee really focused on how we could get some practical solutions that leaders could apply to help address some of their challenges, whether it was related to recruitment and retention, or leadership or a culture of inquiry or staffing and scheduling, things like that. And we released a compendium in bite-sized pieces, if you will. So I think there was three main releases. Each was comprised of 2 to 3 chapters. There was a total of 7 chapters altogether. And the final set of those came out earlier this year, I think in January, February of 2023. On the heels of that, the Workforce Committee has had 3 main focuses this year. One has been on care model exploration, and we partnered with IHI and have some grant funded by Johnson and Johnson that is helping us look at and identify new models of care that are scalable and transferable kind of across different settings. So there's 5 pilot organizations that have been selected to participate in that. And we started collecting a variety of data so that we can measure the outcomes and the implications of these new care models in October, I believe. And so we'll be monitoring those for about 6 months and then summarizing what the findings are and hopefully provide some ideas for nurse leaders to consider in their areas. The second area that we're focusing on is digital transformation and technology and the nurse's role in supporting that. I cannot participate in a conversation around workforce in today's day and age without hearing about artificial intelligence and technology and how they will play a role in shaping the way that we deliver care in the future. So we really are trying to work to identify what are those core competencies, what is the nurse leader's role in selecting that technology, helping implement that technology, managing the change that is required with that technology. I think it's been probably 6 to 8 weeks or so ago that we convened about 50 nurse leaders and other individuals from across the nation and had just a really good generative discussion, dialogue around what that would look like. And these were leaders from industry, leaders from practice, leaders from academia, all focused on those core principles. And we should see in the next couple of weeks a paper out on what the findings of that were and what our next steps are in supporting digital transformation in healthcare. The third one is the nearest to me as I'm helping co-chair that work group with Claire Zengerly, and it is the value of the nurse manager. It's become a little beast in of itself. Is we have a few different work streams that we're working on. One of those work streams is focused on the role of the nurse manager. We had the chairs of that group included Rose Sherman, who was able to help us convene 6 focus groups and generate some discussion with nurse managers from across the nation on what their current role is as a nurse manager and then what they would like to see it evolve to over time. There were, of those 6 focus groups, 3 were focused on nurse leaders who had areas of high turnover. 3 of them were focused on nurse leaders who were trying different models of care. They broke them up into those 2 subgroups and really just learned what we can do to best support those leaders in those types of settings. The second work stream is around span of control and looking at what some of the best practices are and what supportive infrastructure would look like. As we look at the nurse leader role across the nation, you will see a huge variation in what their span of control is. And so you'll have nurse leaders that have 25 direct reports, and you'll have nurse leaders that have 250 direct reports, and you've got everything in between. And some have a great supportive infrastructure that would include leaders to help them support quality and data and assistant nurse managers and clinical nurse specialists and point of care educators. And you have others that really have not much support at all and are managing pretty large departments. So we're trying to coalesce that data and those stories and identify what a reasonable span of control is. One of the ways that we're doing this is we've partnered with the Health Management Academy, and currently underway, there is a study with nurse managers looking at what not just their span of control is, but really their span of responsibility. Because it's not just the individuals that you're managing anymore, it's all of the projects and all of the initiatives that we have going on to help promote and advance the direction that we want to go, but you can't put all of that on the shoulders of one person. The third one is around succession planning. And really that is to help with seamless transition. If we're succession planning properly, then as nurse leaders move through their or progress in their profession, there should be seamless transitions in each of the areas that they lead. We're identifying some best practices as it looks at succession planning. And then the fourth work stream is around data. And that is a beast in of itself. And probably one of the most important elements. It doesn't stand alone as although its own work stream, it's really woven throughout each of the other work streams, because if we do what we're hoping to accomplish with this, we'll be able to use data to help support the case and demonstrate the value of nurse managers. What do I mean by this? Is that there's data that's out there that's been published. Press-Ganey has come out with a couple of blogs this year and articles this year that have highlighted that some of the best practicing nurse managers have lower areas of turnover, have nurses with higher intent to stay, have better quality outcomes, have lower pressure injuries, have higher patient experience, have higher employee engagement. And so when you can tie not just the anecdotal stories to this, but really tie the outcomes and the financial component of this, you can really start to build a case for why we need a supportive infrastructure to make sure nurse leaders are set up for success. That was a lot.
It was a lot, but I think it was all important. You did mention, though, span of control. I think it was the second to last component or the second issue. Did want to put a plug in for season 2, episode 1. We actually had a guest on, Kim Vance, that spent the entire episode talking about span of control. And a lot of the things that you're talking about, like really when you're looking at the manager, you got to understand what are the additional resources that manager has to be a leader. Are they just the leader and the manager of that unit? Or are they also the perceived person that's doing kind of clinical specialist work? Are they doing education work? Are they responsible for all the onboarding? Are they responsible, like all of those other things in addition to just leading the unit and being responsible for outcomes? Of course, I'm oversimplifying the role by saying just leading, but put it in a nutshell. I'd like to shift gears for a moment, if that's okay, and think more back on your time on the board and also your time as president. Looking back on the last 10 years, what makes you most proud?
I, first of all, never imagined that I would be sitting at that table. And it has been one of, if not the biggest highlights of my career, is to have the opportunity to do that. And to have done it for 10 years it blows my mind to think about. So for the listeners, abbreviated version of my story and my tenure on the board, because if you're sitting back thinking, how does somebody get a board seat for 10 years? I would say I'm certainly the outlier there. I'm the gift that keeps giving, if you will. But I initially started my tenure as an appointed board member, and I served 3 years representing early careerists. And then I ran for Region 5 Board of Directors and served 3 years representing Region 5. And then on the heels of that, I ran for president-elect. And during my term as president-elect is when we went through the pandemic. My 1-year term as president-elect turned to 2 years. And then our bylaws changed to now that we have a 2-year term as president. So I'm wrapping up my 2nd year as president, which is my 10th year on the board. That's my long-winded way of saying the thing that makes me the most proud about my presidency as I look back on the last 10 years on the board is that my very first committee, when I joined the board 10 years ago, I was asked to lead a national committee that looked at innovative approaches to recruiting and retaining the next generation of nursing talent. And we convened a group of about a dozen leaders from across the nation, different generations, different sites of care, different regions of the country, and really developed some guiding principles around what that might look like. And 10 years later, I would say our challenges aren't that much different, but the burning platform is much bigger and much brighter. And I feel like I started 10 years ago. I'm putting a bow on with some of our work around demonstrating the value of the nurse manager. And I think we're going to be able to leverage our voice as AONL with the support of the American Hospital Association to really build the case that we need to support nurse leaders. And we're going to be able to demonstrate all of the things that nurse leaders do to impact patients, families, and the team.
What would you say is your greatest learning experience that you had during your presidency?
That's a big question. I don't know that I would say this is a learning experience as much as it is validating for me as a nurse and a nurse leader. Is that I think back to some of the challenges that we've faced, and especially having gone through an initial pandemic, an international pandemic,
Well,
and
pandemic.
a global pandemic. Thank you. And seeing the role of nurses and nurse leaders in that, and hearing our voice be strengthened and our roles being heightened, and the respect that our profession has always had, the trust that our profession has had for the last couple of decades, and to see us called to the carpet, if you will, and deliver time and time again. It has been so inspirational to me, and to see our roles elevated and our credibility just rise. I think nurse leaders are in a better position today than we've ever been to help give guidance and really steer the direction that healthcare goes at a time when we really need a voice of leadership and some direction.
Knowing what you know now, what advice would you have given yourself 10 years ago when you started your time on the board?
We continue to have appointed board members with AONL. And 10 years ago, when I came on representing early careerists, I knew what I was there to represent, if you will. But that didn't change the fact that you're always a little timid, shy, if you will, to speak up and interject that voice. And so if I were to give my self advice from 10 years ago, I would say just say it. We all have a unique voice and perspective that we bring to the table. And I've been blessed to be invited to that table to represent that voice. And for all of the nurse leaders that are out there that get the opportunity to influence and inspire, be your authentic self, embrace it, and know that you're representing other individuals as well.
Your answer to the next question may be the same answer that you just gave, but if it's not, I'm going to ask the question just to see if it differs. As many are aware, our listeners are nurse executives and those aspiring to be in those roles. So thinking about the latter group, those nurses that may become a CNO or a CNE in, let's say, 10 to 15 years, what advice would you give them?
It is very similar. Do you think we all have a brand that we bring as leaders? And I think one of the things that I have tried to embrace as my brand is authenticity. And if you attended last year's annual meeting, you saw me walk out on stage hand in hand with my twins, Jackson and Lexi, who just turned 8. And that was one of the highlights of Jim Ted talking about it, one of the highlights of my career. And for other nurse leaders who can look at me or at other leaders and see themselves in that position and know that they can do that even if they are parents or they're in school for their TNP or they have aging parents that they're trying to take care of, or things just feel overwhelming. It's just pause and know that the world is bigger than us, right? And there are lots of shoulders to lean on. And I certainly could not have done what I did for the last couple of years without the great support of the board, my team here at Norton Children's, my family at home, my husband, who has been a rock star, my friends that have been there to lift me up on those tough days. But we're in it together. And I would say own who you are and surround yourself by great people.
As we look to the future for both nursing and nursing leadership, what thoughts come to your mind?
You asked me this question last year too.
Yeah,
I am still wearing rose-colored glasses. I am still optimistic, and I think our future is bright.
it's exactly what you said last year. Our future is bright.
As I alluded to earlier, I think we are positioned better than we ever have been to make advances and to make changes that are going to impact the future nurses and the future delivery of care for many years to come. And our time is now. And so I feel really optimistic about some of the tables that we've been invited to, some of the platforms that we have. And I don't think I said this earlier, the alignment that I see so often with some of the professional associations, whether they're state based, whether they're national based, whether they're internationally based, I see nurses aligning their voice to make a difference because we're stronger and better together.
Any closing thoughts as we wrap up this episode?
Thank you for reaching out and interviewing me. And thank you to all the individuals that have supported me over the last 10 years, really. It has been an incredible honor. And I am so humbled to have had the opportunity to serve as president. I think I said earlier, true highlight of my career. And I'm just grateful.
Erik, thank you so much. I appreciate it.
Thank you very much, Nate.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.